we need to be our own health advocate. We can't rely on conventional medicine to take care of us. We really have to do our own research. You look from a functional medicine perspective, you're looking at the body as a whole, as opposed to pharmacy and conventional physician training, where you look at a symptom, you target that, and you give a drug for it. Drugs for depression, drugs for chronic pain. It's a merry-go-round, and it's a terrible ride, and people can't get off it.
Headaches affect virtually everyone listening to this at some time or other. Wouldn't it be nice to have a simple, natural, drug-free solution? Hi, this is Dr. Mercola helping you take control of your health, and today I'm joined by America's pharmacist, Suzy Cohen, who has many attributes to her career, but one of the more interesting ones is she's actually been on Dr. Oz as many times as I have. And she's been on The View and The Doctors and many other programs, and she's the author of 8 books, and including the #1 Amazon hit, Headache Free, Relieve Migraines, Tension, Cluster, Menstrual, and Lyme Headaches. So we are just honored and delighted to have with us today Suzy Cohen. So welcome, and thank you for joining us.
Thank you, Dr. Mercola. It's nice to be with you.
So I think it always helps our viewers to understand your perspective. I mean, most pharmacists are really buried in conventional medicine because they're using the primary tool that most doctors use, which is drugs. You certainly have a grounding in that. That's why you're called America's Pharmacist, and you write about that. But can you tell our listeners a little bit more about how you made the transition from conventional pharmacy to natural medicine?
Sure. So I graduated in 1989 from the University of Florida, like all the other pharmacists in my class, and I knew the next best drug. Drugs were not a problem. I worked at a local retail chain pharmacy, and I had experience in hospital pharmacy. As a side job, I also worked in nursing homes. So long-term care facilities really taught me the most. When you work in a nursing home, you see people that check in, but they don't always check out. And this was in Florida. So it was a real awakening to me because some of the people that were passing away or that were very sick, they were very young. They weren't in their 80s and 90s. They were 40, 50 years old. And so this really stuck with me. It was like, how can I think further upstream to help people so that they weren't so sick and terminal at such a young age? So that really hit me as a young woman. I'm kind of sensitive. And then compounded with that, I worked in a pharmacy as well, and people would call and say they were getting side effects from the medicines that they had picked up from the pharmacy. So I was thinking, how is that happening? That isn't right. I gave them medicine, and my partner at the pharmacy gave medicine, and these people are sicker with side effects than what they came in for. So while this is all ruminating in my head,
and that was a common experience, right?
Yeah, it was very common. And while that was ruminating in my head, my husband was at home and he wasn't feeling well and he wasn't responding to conventional medicine. So I really started to think outside the pill, if you will, looking at Mother Nature's medicine cabinet, thinking there has to be something that can help my husband and help these people in the nursing home and help my patients at the pharmacy that had less toxicity than what I had been taught in pharmacy school.
And how did you come to acquire knowledge about natural therapies that might be effective alternatives?
I studied on the internet and mainly, well, that was just a little bit. Mainly, I joined an organization called the Institute for Functional Medicine. And so I am a graduate of that course training, a functional medicine practitioner, and I learned from that how to look at the body as a whole. So you see, in pharmacy school, we look at symptoms and then we target symptoms with a drug by altering a pathway or changing the level of a hormone or a neurotransmitter. But in functional medicine training, we look at the body as a whole and we start to point all the different symptoms and think of that as one thing, like how is that spiraling down? So a person with 6 symptoms could be reactive to one food, for example, and it could be tied to the increase in one inflammatory cytokine, say histamine, which is a big one with headaches. And so when you look from a functional medicine perspective, you're looking at the body as a whole, as opposed to pharmacy and conventional physician training, where you look at a symptom, you target that, and you give a drug for it.
And would you say, well, first of all, the average person over 65, I believe, is taking more than 31 drugs, prescriptions a year, and again, at least 31 refills a year. And would you say it's safe to assume that most drugs don't really address the cause of the disease? They merely mask it and treat the symptoms.
Oh, Dr. Mercola, you're so right. Absolutely.
So, and that's the primary, the fatal flaw of the whole system is that it's really a symptomatic-based cure.
Yes.
Or solution. Yeah. Solution. They don't advocate it as a cure, but it's a solution and it's a process. And with rare exception, do they address the lifestyle changes? And mostly, the excuses that they give is that people aren't interested in lifestyle changes. That's certainly true for some, but there are certainly large numbers of people who would be very interested in finding out alternatives.
100%. And your audience loves you, and they believe you, and they follow the lifestyle suggestions that you offer on your site. And thank you for that. And so it's the same thing in the pharmacy that I saw, is people were willing to go next door to the supermarket and pick up figs or prunes. They weren't so interested in heavy duty drugs to fix their digestive system. And by and large, you'll find that people are sensitive to gluten. Everyone reacts to that, to dairy as well. And I'm talking about the proteins in wheat when I say gluten, and I'm talking about the protein in dairy called casein, as well as soy and high fructose corn syrup and corn and eggs. These are all what I call migrainades. It's a made-up term that I trademarked. So migrainades are things that go off in your body like a grenade and cause a migraine or a headache. I use the term loosely. So a migrainade for one person could be gluten. For another person, it could be artificial sweeteners. It could be MSG, could be caffeine, could be foods that contain histamine.
Well, let's talk a little bit about the headaches and migraines. I think we can focus on, because it's one of the most devastating types of headaches. I think cluster headaches are worse, but they're far less frequent, and many people have experience with them. So maybe you can discuss some of the symptoms, because the pain is so. I've taken care of many people with migraines and had opportunity to observe their pain, which is just beyond extreme in many cases, to the point of really suicide. It's so bad. So yeah. Obviously many drugs are used to address this. So why don't you talk about the symptoms?
Okay.
Talk about the cause.
Sure. So when you say headache to a person, it could mean all kinds of things. With a migraine, it's almost a full body experience, even though the pain is in the head usually, of course, but you can have all these weird neurological components to it called an aura, or people will sometimes refer to it as a halo, where they see the light around things. And it's usually visual problems and flashing lights or zigzag lights or visual snow. You'll see a lot of visual stuff. Sometimes they lose their vision temporarily. This can happen especially if you get dehydrated. And then there's nausea that goes with it. Sometimes people have pain.
Yeah, and the symptoms can simulate very effectively a stroke. And in fact, there's very little difference between the two, and many times people have to go to the ER to have that ruled out.
Yes, it can be very scary for some people, and many people will just come to live with this as part of their life. With migraines, this affects a large part of the population, and pharmaceutical answer to that is what's called a triptan. This is a class of medications, and you'll see them by brand names such as Axert, Zomig, Imitrex, Maxalt, Emerge, many others. They're offered by injection or by nasal spray or by tablets. So these drugs work by constricting the blood vessels around the brain. You see, the brain doesn't hurt. The brain doesn't really feel pain. It feels like it does because the blood vessels around the brain are swollen. So these drugs come in and they increase levels of serotonin, which most people understand as a happy brain chemical, but that also constricts the vessels. So they act as a vasoconstrictor. And when you reduce that blood flow around the brain, the pain usually goes down. That's the hope. But you can't take these drugs often, and they come with some pretty serious side effects, even those that can affect the heart. So I'm not an advocate of a person living on a triptan to take care of their migraines. To me, you have to get rid of the underlying cause.
And there's a financial cost too. These drugs don't come cheaply, as I understand.
They're very, very expensive. And so what I would suggest to somebody is find the root cause and fix that. The emerging new studies that nobody's talking about, that I talk about in Headache Free is...
And Headache Free is your book on this. Why don't you show us your book?
Yes, okay.
There it is, Headache Free. It's a phenomenal resource that goes into all the details we'll be discussing here.
Thank you. So in Headache Free, I offer a large amount of research, and it's a conversational tone so everyone can understand it. But the basic meat of my research is that headaches, especially migraines, are caused by mitochondrial dysfunction. And if you can fix the mitochondria, then you can relieve migraines and headaches. If not cure them, you can certainly reduce the frequency of them.
And for those who may not understand what a mitochondria is and haven't taken biology, maybe you can explain that.
A mitochondria is an organelle inside your cell. You have trillions of them. You have like 3 pounds of them. They generate your cellular energy. Your ATP is what it's called. It's like a battery or a generator in every single cell. And when your mitochondria, or we'll call them mito, we can call them batteries for that matter. When your batteries are sick or dying or they're oxidized because of excessive free radical damage, and then your frequency for headaches goes up. And this has been shown in a lot of research, which I cover in Headache Free. The meat of it is that when these mito are sick or struggling, then your cells can't generate enough energy and you're more apt to have headaches.
Maybe you can discuss about some of the things that people can do to address these.
The medicines that we're taking, things that are seemingly innocuous, can be robbing our body of certain nutrients such as CoQ10 or ubiquinol, like you said, and magnesium. And this can trigger headaches or at least increase your odds. Another one is riboflavin.
Diet is another important component, especially not only for migraines and headaches in general, but just for being healthy. So maybe you can discuss the diet influence and the effect of extra weight on headaches.
And so when a person goes gluten-free, not only do they support their brain health, but they also support the microvilli in the gut. So gluten is getting to be known as bad. People are already getting that it's a food additive and we should stay away from it. And I do think one of the fastest ways to lose weight is to go gluten-free. But gluten is just one aspect. And to me, it's a small aspect. Honestly, to me, it's stress and cortisol and thyroid hormone. We need to be our own health advocate. We can't rely on conventional medicine to take care of us. We really have to do our own research. How else are we going to help? What is the answer? We're just going to take more Triptans and more NSAIDs and in come more drugs. And those are drug muggers of everything. So they're stealing nutrients. Well, then in comes drugs for erectile dysfunction, drugs for depression, drugs for chronic pain. It's a merry-go-round and it's a terrible ride and people can't get off it. And yet it's all they know.
Yeah, well, let's give people a perspective. And I'm sure you haven't done a comprehensive review, but I'm just wondering your gut feeling as to what percentage of people struggle with this and are using the conventional approach, the drug-based model, and not really applying these. Would you say it's over 90% of people with headaches?
Yes, I would say between 70 to 90%. And tension headaches are a big one too. They won't take you out.
Talk about tension headaches and maybe the percentage. How many people get tension, and what percentage are tension, and the other percentage are vascular or migraine, and then clusters, of course.
Okay, so with tension headaches, this is the most common type of headache, probably upwards of 100%. So tension and stress are the players in tension headaches. That's exactly what they're about. And it's not a full body experience like a migraine headache. It's more localized, and usually it's because people are holding tension in their traps or they're in the back of their neck or head, and you can still address it with nutrients. One of the best things that one can do would be magnesium because it relaxes your body. It relaxes muscle pains. If you're tight and irritable, magnesium will reverse that. And rhodiola is helpful for someone with a tension headache because rhodiola increases levels of serotonin, makes you feel good.
And what is rhodiola for those who don't know?
Oh, rhodiola is an herb. It's a Siberian herb. So yeah, so anything like that would be helpful to reduce tension headaches, and in particular, massage would be great. It's known to reduce cortisol. It takes you away from your work and your computer, and if you can just try to relax into that, then that would be helpful for the long-term fix. There's study after study that show natural supplements in high quality forms can help reduce our risk for headaches. The only time I ever think, maybe it's not going to help you that much is possibly with cluster headaches. These are the types of headaches that are also dubbed alarm clock headaches. But with the cluster headaches, the real key, aside from melatonin, would be to reduce histamine containing foods.
What now? I think it's important to mention cluster headaches, but can you comment on the frequency? Because in my clinical experience, I think I've seen certainly less than 5 people with them, and I think they're relatively uncommon.
I mean, I'm just estimating here. I would say about 5% of the population
that's good to know.
Will have experienced it at some point. But there's more data in my book about it too.
Yeah, and again, the solutions for cluster migraines or tension headaches is really the foundational core of what we've been talking about, is to address the dietary issues, and that will be a treatment for all of them, and not only headaches but generally, but health specifically. Well, you've given us so much information, and there's more resources for people who want. Well, before we go into those resources, why don't you give us the highlights of what we just reviewed, so people, and reinforce some of the important points, or maybe mention anything you neglected to at this point.
Well, the highlight for me to get out there is that you do not have to live with headaches. You can live headache-free if you determine the underlying cause of your headaches, which by that I mean find out what your migraine is. It could be a food additive, it could be a type of food that you're eating, it could be histamine, it could be artificial sweeteners. Find the migraine, get rid of it, and that will help you clean up your diet, and then support the batteries in your cell, the mitochondria, support them with cell-loving nutrients such as CoQ10 or ubiquinol, acetyl L-carnitine. You can also use natural minerals to support them and get all those enzymes to run, like magnesium, for example, and selenium could be very helpful because it supports thyroid function.
So, and you've got a number of resources. You have a website, what is your website?
It's my name, SuzyCohen.com. And on my website, I do offer
S-U-Z-Y.
Yes, SUZYCOHEN.
Yeah, so if you suffer from headaches regularly and you're relying on a drug model, it's very clear that there's some better options for you. I certainly would apply many of the recommendations Suzy's provided here, but pick up the book and go into more details, and hopefully you'll have a inexpensive, non-toxic solution, not a symptom reliever for your headaches.
Thank you, Dr. Mercola.
Well, thank you for all the help you provided and giving us these great resources. Really appreciate it.
Thank you.